So good morning. In today's session, we are going to cover a few talks. Let me just get this going. Initial hiccups. So we're going to cover a few topics today during our live session, live at 6. The number one question is, sir, during pregnancy, period of the partner for 9 months, should the man go off taking finasteride, as I have read this medication or its traces are absorbable through the skin? So is it possible that even very microscopic particles of the salt could enter her body accidentally through touch or breath? Or only the medicine has to be out of physical touch by the pregnant woman and the man can take it orally? Needs little reframing though, but the whole essence of this is that during the pregnancy of the partner, should the male partner be careful about finasteride such that it should not get absorbed through the skin or through touch, and how careful should the couple be about finasteride, because the male partner has been taking finasteride for his hair loss. So that is the question. So he's correct to be cautious about the use of finasteride during his partner's pregnancy, because finasteride, as we all know, is a class X drug. It's classified as a class X drug. That essentially means that it can cause fetal abnormalities in the male fetus. Fetal abnormalities like genitalial abnormalities like hypospadias, and a host of other abnormalities like cryptorchidism and so many more. There is a significant concern regarding the potential teratogenic effect of finasteride on the developing fetus, particularly the male fetus. The medication, if absorbed through the skin or inhaled, could cause birth defects. Most of us know that. Although the skin absorption is very limited, but there are not sufficient research studies to tell us whether even the minuscule quantity of finasteride will cause birth defect. So as far as I am concerned, as far as I advise my patients, is to stay away from finasteride. Before conceiving a pregnancy, stop finasteride for about 60 days. When you're not sure about pregnancy, when you're having sex, have it with protection on. And even after the pregnancy comes about, in the first 3 months, these 3 months are very crucial during the formation, the development stage of the fetus. During this time, keep the medication strictly away from your partner. Best is to keep it locked so that she doesn't accidentally, because she's also taking a whole lot of medications right now, she should not accidentally touch or even ingest the medication that you have kept there, because it can lead to disaster. How serious or how common this is not very well known, but finasteride can cause significant teratogenic abnormalities in the developing fetus. So best is to take caution and do as per the label on the medication states. So the traces of finasteride in the environment, on the skin, in the air, or on the surface can potentially be absorbed by the pregnant woman. Although it is likely that the amount would be very small, to be completely safe, it is best for the man to cease taking finasteride while his partner is pregnant, and to take precautions to avoid unnecessary exposure to finasteride. The second question is, sir, I have questions. I wanted to start finasteride again after taking for a month, but during these days, not sexual side effects, but I had experienced severe brain fog and slow thought process, and can't learn properly and forget things so much before that I was normal, and I didn't forget things so much before. I fear so much for this because my daily activity is like I need to learn so much on daily basis to survive this kind of routine. So he's having his exams. I have Please take this question in your next live session, please. I will take finasteride and okay with sexual low libido, but I fear for brain fog. This is a very legitimate question because a lot of people talk on the internet about brain fog. So occasionally people on finasteride report similar cognitive symptoms, albeit a minority. Finasteride works by inhibiting the enzyme 5-alpha reductase, as we all know, which reduces the conversion of testosterone to dihydrotestosterone, the active metabolite of testosterone. While DHT reduction primarily affects hair follicles, this enzyme is also present in certain brain regions. There, it plays a subtle but potentially significant role in neurosteroid metabolism, particularly of allopregnanolol, a compound that contributes to mood regulation, to cognitive function, and learning process. When finasteride lowers allopregnanolol levels, it may interfere with GABA neurotransmission, which could in turn lead to symptoms like brain fog, slowed thought processing, and even issues with memory and focus. This has been corroborated by neurophysicians that I have talked to, but it does not happen in all. It happens in only certain patients who are prone to this. However, it's crucial to note that the scientific research is still ongoing, and definitive conclusions about the extent of these effects when you're taking finasteride and having brain fog are still forthcoming. That the researchers have not arrived at a final conclusion of how significant it is, how significant brain fog is when you're taking finasteride. But of course, it's a significant concern, even if there's an iota of doubt that is going to cause brain fog when you're preparing for exams. It's a once in a lifetime event. It will determine your career, your life ahead. So I feel personally that when you're talking about exams, you should take, and when you have this doubt about brain fog, when you're taking finasteride, I will suggest that you abstain from taking finasteride, let your exams be over, and then start. But however, if you still need to take it, do it in consultation with a competent doctor who will advise you in your best interest. And then we go on to the third question, that is it possible finasteride can raise prolactin levels? Or is serum effect of finasteride normally negligible on prolactin? Thanks for another great video. Well, thank you for bringing this up. The effect of finasteride on prolactin is generally considered minimal, with most studies indicating that finasteride's primary endocrine action is selective inhibition of 5-alpha reductase, affecting the conversion of testosterone to DHT without direct interaction with prolactin pathways. So finasteride has no effect on prolactin pathways. So whatever we think about prolactin, if you have noted a surge in your prolactin levels, it could be just coincidental and anecdotal appearance. However, in rare cases, individuals have reported changes in prolactin levels when taking finasteride. The mechanism behind this is not fully understood, though some researchers suggest that shifts in neurosteroid balance due to finasteride might indirectly influence the hypothalamic pituitary axis, the HPA axis, which regulates hormones like prolactin. While these changes are typically and not clinically significant, sensitivity to hormonal fluctuations varies between individuals. So monitoring for symptoms of hyperprolactinemia, that is increased prolactin levels in the blood, such as fatigue or breast tenderness, is always wise. Overall, finasteride serum effect on prolactin is generally negligible, but if you have concerns, it's reasonable to check prolactin levels periodically and stay informed about your body's response. And I appreciate your engagement. Thanks for watching. The next question number 4, with proper care and maintenance, how long will the transplanted hairs last for a man? Since you're doing surgery for 18 years, doctor, did you see any of your first patients recently? How is their hair now? So as I have stated in a lot of videos before, and I will put a link after I conclude this video about my long-term hair transplant results with and without finasteride. You always don't have to take finasteride. If your hair loss is stable, that is the time to stop finasteride. Finasteride is a drug to be taken judiciously, and as little of the drug is to be taken as possible clinically in consultation with the doctor. So I have a very large series of patients' results over 10 to 15 years, and I will provide a link in the description also, and a link above. The longevity of transplanted hair is one of the most reassuring aspects of hair restoration surgery, given that the follicles we transplant are genetically resistant to DHT and thus remain largely unaffected by the hair loss process. With proper care, transplanted hairs are essentially for life. Once transplanted, they typically maintain their hair growth pattern as long as they would have in their original position or in the donor area. Having performed hair transplants for over 18 years, I have indeed followed up with several of my earliest patients. Some patients date back to as old as 2010, 2009. I'm pleased to report that the vast majority retain excellent hair density in the transplanted areas, provided they follow up with me from time to time. These patients have been able to enjoy lasting, natural-looking results, especially when they've followed the recommended care protocols and in some cases combined treatments in low-dose finasteride or minoxidil to maintain the native hair around the transplanted zones. In essence, while nothing in medicine is ever guaranteed and nothing in the body is permanent, a well-done hair transplant on suitable candidates offers lasting, reliable results that, in my experience, hold on beautifully over the years. So we go on to the fifth question. Doctor, I'm 17 and I have excessive hair fall and my hairline is already receding. So I have started taking finasteride. Please reply, can I continue? So my question to him is that nowhere has the company Merck, which originally brought in finasteride as Propecia, ever mentioned that you can take the medication at an age less than 18. In my clinic, I personally wait for the body to develop till the age of 21, fully develop till 21, and then I initiate the patient on finasteride at 21. Occasionally, very rarely though, I have started patients of about 20-21 also on finasteride, low dose though, in emergency when the hair fall is very, very aggressive and the patient is mentally devastated. And if I have seen that his body is fully developed. Your concern is, though understandable, that at 17, if you've started, I don't know whether you've consulted your doctor before starting this medication or not, or you're taking it on your own, because in many countries, finasteride is available across the counter, unfortunately. Early hair loss can be distressing, especially at 17. However, the decision to start finasteride at your age is wrong. Finasteride is generally recommended for adults as it can interfere with hormonal balance, which is still stabilizing in adolescence. In some cases, starting it too young can lead to hormonal disturbance, potentially affecting mood, libido, or even skeletal development, although the latter is quite rare. So before we go into the next question, so I would also like to tell you that before continuing with finasteride, I would recommend discussing alternative strategies with your doctor and hold on to your urge to start finasteride so early. Take oral minoxidil instead, take other treatments which may be beneficial to you. Often approaches such as topical treatments like minoxidil, lifestyle modifications, and nutritional support can help manage early stage hair loss without the risk associated with hormonal treatments at this tender age. Your doctor may also want to rule out other factors of your hair loss in your case, such as deficiencies or other medical conditions that could contribute to your hair fall at such a young age. So that brings us to the sixth question by Patriot8356, which was posted yesterday. Sir, my hair transplant was done 4 years back. 2 assistants extracted and punched grafts under doctor supervision. After 1.5 years, I found that many grafts lost from left side of the head, which was operated by one assistant, while right side of head done by second assistant was perfect with no loss of grafts. This shows experience and hands of assistants are also important. So this is more of a statement than a question, but let's dilate on this further. So he's absolutely correct. And his experience highlights that a crucial aspect of hair transplant surgery is who's doing your hair transplant procedure, which is generally kept undercover. It is most clinics talk about the technique of hair transplant, but eventually when you ask them who's going to do the hair transplant, that is when they completely go silent. Technical skill and experience are essential at every step, including graft extraction and placement. A study in India revealed that over 97%, and that's a huge number, Over 97% of Indian clinics are doing hair transplant without even the supervision of doctor. These are teams that take ORs, operation rooms, operation theaters on rent, pay the doctor by the day, by the hour, and under the umbrella of his care, of his supervision, not direct supervision, but regulatory supervision, if you may like, do the procedure. The result in these clinic, therefore, is not standardized and will be as good as the technical team who's taken the operation theater on rent for that day. As per regulations, in our country, it's the National Medical Council. As per regulations, only the doctor who should be either a plastic surgeon or a dermatologist should be doing the procedure. The dermatologist or plastic surgeon should do the procedure. The parts of the procedure that he should do is all aesthetic considerations of a hair transplant, all surgical steps of the hair transplant. And the surgical steps of hair transplant are the complete extraction and complete slit making. Also, the hairline design, which is very crucial and can make the patient undergo a phase of devastation psychologically if it goes wrong, is to be done by a competent trained dermatologist or a plastic surgeon. The anesthesia itself, local anesthesia if needed, is to be given by the dermatologist or the plastic surgeon. If you need sedation, if you need to give patients sedation because of several reasons, it has to be done by the anesthetist on duty. In my clinic, I do all the steps that I have just enumerated, that is the hairline design, the counseling, even the trimming of hair, because by trimming of the hair, I understand the quality of hair at the back of the head better. And then I also do the anesthesia, the complete harvesting, in all cases done at Darling Bird's clinic, are done by me. And then anesthesia in the recipient area, slit making. Slit making is very important because slit making determines the density. It determines the angulation of grafts, which determines the naturalness, the overall naturalness and overall appearance of head full of hair when the outcome unfolds itself. So these are steps which are very crucial for a doctor to do. Also, following up the patient for a long period of time, say 1 year, 5 years, 10 years, 15 years, because it's not the hair transplant only which is going to give long-term results. You're also going to need medical treatment because it is a genetic process. It is not just a mechanical shifting of grafts from the donor area to the recipient area. It is much more than just hair transplant. If you do not understand the role of medication when your hair loss is progressing, please do not go in for a hair transplant. I have said this n number of times on my channel. You will really be devastated over the years. You might look good right now for a year or two. And this is the reason why most clinics do not show long-term hair transplant results. They show only results in 6 months after the hair transplant and 1 year after the hair transplant. And that, my friends, is a reality. Please check out all the videos on all channels and you will come to know for yourself. Do your research before going in for a hair transplant. Do not take medication lightly. Hair transplant is not going to be a solution of all your woes. In fact, if you do not take medication, you might land from the burning pot into the fire. It is so bad. And there are so many tragedies, so many horror stories. Patients think that the hair transplant has failed. It is not the hair transplant that has failed. It is you or your doctor who has failed the hair transplant. Remember that. So the next question is by Mr. Abdul Rahim Hamid Mohsin, and this is from Pakistan, and he wants to get an online consultation. You are most welcome. Contact us on the numbers that we have provided in the description. I'm 22 years old. I have been taking finasteride of 1 milligram for 3.5 years, but its effectiveness has started to fade so much that I'm losing more hair than ever and noticing my hairline go back. I'm very stressed because of it. Please guide me. Please reply. It will be really very helpful. Yes, so I have online consultation scheduled with you, Mr. Rahman, in the next 1 week, I think. So while answering your query here, thank you for reaching out, and I understand how distressing the situation is. It's not uncommon for the effectiveness of finasteride to diminish over time for some individuals, which might explain the increase in hair loss you're experiencing. And many times we refer to this as tolerance. It's a loose term, tolerance to finasteride. Finasteride works by blocking the conversion of testosterone to dihydrotestosterone, which is a key factor in androgenic alopecia, male pattern baldness. However, its effects can plateau or reduce as hair loss progresses, and in some cases, it may no longer be effective in the long term. And there are so many reasons for this, and I've covered them in multiple videos before. And I have devised my proven strategy, the 5 strategies while you're taking finasteride, how to prevent tolerance and how to optimize results even with low doses of finasteride. And you can see the video in the link which I have provided in the description below and also here. So at 22, you're too young, and there are several options you can consider. One is seek a hair transplant consultation. Seek a consultation from an expert hair loss doctor. Reevaluate your medical regime, your medication protocol along with him. And also, more significantly, your dietary changes, proper stress management, lifestyle changes, sleeping at normal hours, planning your day ahead will go a long way in preventing tolerance of medication. I would be happy to guide you over this week during your consultation, and I look forward to talking to you. Thank you for this question. So the next question is GFC better than PRP? Doctor, please reply. So it's an excellent question. A lot of talk about GFC in the Indian social media platforms. So growth factor concentrate and platelet-rich plasma, PRP, are both treatments derived from a patient's blood, but they differ in preparation and concentration, which can impact their efficacy for hair growth. It's important to note that while GFC can enhance hair growth by stimulating hair follicles and improving scalp health, it is not a replacement for finasteride. GFC does not act as a DHT blocker, which means it doesn't address the root cause of androgenic hair loss, as we all know, we've covered in this live session as well. Finasteride specifically works by inhibiting the 5-alpha reductase, which converts testosterone into dihydrotestosterone, and this is the stage we seek to block while taking finasteride. This reduces the DHT levels in the scalp and helps prevent further miniaturization of hair follicles. GFC is a more refined way of PRP, and if PRP has been beneficial, or over a period of time, PRP result is fading out, especially in women who are taking PRP. Yes, GFC is going to be more beneficial, provided you are not suffering from aggressive hair loss due to androgenic alopecia, in which you need to go on DHT blocker, not PRP, not GFC. So in conclusion, GFC appears to be an advancement over PRP in terms of growth factor concentration and bioavailability. However, it may come at a higher cost and might not be readily available in all clinics. Both treatments are valuable, but if you have access to GFC and are looking for possibly better results with fewer sessions, it may be worth considering. Last question. After I've lost all of my native hair, I had 2 hair transplants at the age of 40. Do I have to use finasteride since my native hair is already gone? So his question, I would like to reframe, is that he's had 2 hair transplants. After all his hair were lost, he was probably grade 5, grade 6, grade 7. He's taken all grafts from the safe zone. All the hair on his head are now transplanted hair. So does he still have to take finasteride since all his native hair have gone away? So the answer is, since you've already lost most or all of your native hair and have undergone 2 hair transplants, the role of finasteride in your case may indeed be different. Finasteride is primarily used to prevent further miniaturization and loss of native hair. However, transplanted hair follicles are generally resistant to DHT as they come from the permanent zone, in most cases from the donor area, which is not typically affected by androgenic alopecia. In theory, though, this does not happen, because if you have grade 6 or grade 7 male pattern baldness, it is more likely than not that your donor area will also start to miniaturize. Nothing in the body is permanent. So if the grafts that have been taken from a donor area would have miniaturized by this time, your hair would also start to thin. So you cannot say that you can be off finasteride in all cases. You will have to get a consultation with a competent doctor, and he will tell you whether you need to be on finasteride, though low dose or full dose or high dose, or you can safely be off finasteride, but under his supervision. But ultimately, the decision to take finasteride lies with the patient, because there's so much of mental agony while many patients engage in ingestion of finasteride. So I would suggest that they should take finasteride, as much finasteride as their body and their mind can tolerate. So that was the talk for today, the live session today. And now we are wanted to tell you one update that we are planning to have our live sessions not every day, because not many people are presently joining, and doing live sessions every day is quite laborious, and it prevents me from making more content for social media channels, and also it interferes with my other consultations, which I'm going to now do after the session for about half an hour. And of course, I have to go to work at 7:30. So have a nice day. I hope you enjoyed this live session. If you have any questions about hair loss treatment for men and women, about hair transplant, do drop a message and I'll be happy to reply. As always, thank you for being on the channel. And if you haven't subscribed, it'll be a pleasure to have you on this channel. Thank you for being here today. Have a nice day and God bless you.